Have you ever wondered why two people experiencing digestive discomfort might face vastly different health journeys, some managing symptoms, and others needing serious medical interventions? The core distinction in complications between inflammatory bowel disease and irritable bowel syndrome stems from their fundamental nature. IBD, which includes Crohn's disease and ulcerative colitis, is characterized by chronic inflammation that damages the digestive tract, potentially leading to severe and life-threatening complications. In contrast, IBS is a functional gastrointestinal disorder, meaning it involves issues with how the gut works, but without causing inflammation or structural damage to the bowel itself. The reason IBD leads to such severe complications is because its inflammation is persistent and destructive. In Crohn's disease, this inflammation can penetrate through all layers of the bowel wall, known as transmural inflammation, leading to strictures, fistulas, and abscesses. Ulcerative colitis, on the other hand, typically causes inflammation of the colon's innermost lining, or mucosa, which can result in bleeding ulcers and an increased risk of colon cancer. Because IBS does not involve inflammation or tissue damage, its complications are not structural. Instead, they focus on persistent discomfort and quality of life issues such as chronic pain, bloating, and altered bowel habits. Understanding these differences helps you recognize when symptoms might indicate a more serious condition. For IBD, complications can manifest as severe abdominal pain, persistent diarrhea often with blood, unexplained weight loss, fatigue, and sometimes even malnutrition. These are signs of active inflammation and potential tissue damage that requiring immediate medical attention. For IBS, while symptoms like abdominal pain, cramping, bloating, and changes in bowel frequency are common, they do not lead to physical damage or increase the risk of conditions like bowel perforation or cancer, which are serious concerns for IBD patients. It is crucial to distinguish between these conditions because the long-term outlook and management strategies are drastically different. IBD complications often requiring intensive medical treatments, including medications to suppress the immune system, and sometimes even surgery to remove damaged parts of the bowel or to repair strictures and fistulas. While IBS can significantly impact quality of life, its management typically involves dietary adjustments, stress management, and medications aimed at symptom relief rather than preventing organ damage. Ultimately, recognizing whether your digestive symptoms point to a functional disorder like IBS or an inflammatory condition like IBD is vital for protecting your long-term health. Accurate diagnosis ensures you receive the appropriate care and can prevent the progression of potentially severe complications, helping you live a healthier, more comfortable life.